Hi, I'm Dr. Bridget Herschap, Medical Director of the National Bone Marrow Program at CorePath Laboratories. Today, we'll cover the proper techniques and common mistakes to avoid when obtaining bone marrow specimens. These include peripheral blood smears, aspirate smears, and core touch imprints, all of which are essential for an accurate diagnosis. Bone marrow biopsies can provide valuable information to help hematopathologists diagnose hematolymphoid neoplasms, including myeloid disorders, leukemia, lymphoma, myeloma, and other diseases. Many advanced practice providers have had little to no training when it comes to optimal specimen preparation. Here at CorePath Laboratories, we put caring for lives into action by offering education and hands-on training to ensure a quick and accurate diagnosis. Stay tuned to learn how to make optimal bone marrow specimens.
How to make peripheral blood smears. You will need blood, a pipette, and your slides. For peripheral blood smear slides, less is more. You will need just 1 drop of blood on the slide. Then grab a second slide. Angle it, and you're going to pull back. Let the blood spread and push forward. Let's do another example. Place a drop of blood. Grab a second slide. Angle it and pull back. Let the blood spread and push forward. Let your slides dry, then label the frosted side of the slide with a pencil. And that's all there is to making perfect blood slides. Now, let's go over how not to make peripheral slides. You do not want to use too much blood for peripheral blood smears. There are many reasons for this. Using too much blood can lead to several issues when making a peripheral smear. First, a thick smear causes poor cell distribution. Cells overlap, making it hard to see individual details or perform accurate counts. Second, uneven drying can create artifacts like smudging or cell distortion and cause inconsistent staining. Third, thick smears don't stain evenly, making it difficult to assess cell morphology. And finally, it wastes time and materials, since thick smears often need to be redone. For best results, use just a small drop of blood to create a thin, even smear with a smooth feathered edge. To create the perfect bone marrow aspirate smear, you'll need blood, a pipette, your slides, and a dish. It's best to do the bone marrow aspirate smears as soon as it's taken from the patient while it's very fresh. That way, it doesn't have to sit in the anticoagulant at all, as anticoagulant can cause some morphologic distortion. Once you have your aspirate smear in your dish, gently swirl the specimen and look for particles that look like little pieces of glass or grains of sand. These are the spicules or particles. Use your pipette to collect or draw up a couple of particles and place them very carefully onto the top third of the slide near the frosted end. Be sure to not put too much blood. Spill a portion of the specimen and use the pipette to suck up extra blood. You'll be able to see the particles once all the surrounding extra blood has been re-aspirated. Now, we're going to take another slide like so. Place it perpendicular to the other slide and lay it right on your specimen. Let the weight of the slide spread it, and gently with no pressure, pull the slide apart. And you'll see a greasy appearing white streak down the middle of your slide. Aim for a thin, even smear that spreads marrow particles gently across the slide. The perfect aspirate smear shows visible marrow spicules, a smooth feathered edge, and a clear background. This allows easy examination of cell morphology and overall marrow quality. Now, let's go over how not to make bone marrow aspirate smears. Just like with peripheral smears, using too much blood and a bone marrow aspirate can cause problems. When there's excess blood, the smear becomes too diluted, washing out marrow particles and making it harder to evaluate cellular detail. It's very important to let the slide air dry completely before packaging it in the slide mailer. Slides that have been packaged while still wet will show cytological artifacts that make the cells difficult to identify under the microscope. A well-prepared aspirate slide with feathered edges and balanced cellular spread ensures accurate and reliable microscopic evaluation. How to make bone marrow core touch imprints. You will need forceps, your slides, and a bone marrow core. When you obtain the bone marrow core biopsy from the patient, it may have clotted blood on the surface, and it's important to pick the clot off of the surface of the bone marrow. If you make a touch imprint without removing the clotted blood from the surface, the only cells viewable under the microscope will be blood cells rather than bone marrow cells, and will present morphological features too similar to the peripheral blood smear. Once the core is all cleaned off, you're going to place your bone marrow near the frosted end on the slide. You're going to take another slide and gently roll the specimen along the surface. You can use the same slide to make multiple imprints, or transfer the core onto another set of slides as needed. Ideally, you'll want to prepare 5 touch imprints in total. Let your slides dry, label, and voila! Perfect slides every single time. This is a demonstration of what not to do. You may have seen people touch the core to the slide. However, it is best to avoid this technique as this can cause retraction artifact, and less cells will shed off the core. It's as if you're pulling a paint roller, retracting it away from the wall, and you can imagine the paint will heap up. The same thing happens with cells if you pull. It is important to roll the bone marrow core, but be careful, as excess pressure can destroy or distort the cells. When you're done making all the slides, place your core biopsy into formalin. Note that touch imprints should only be performed on the core prior to being placed in formalin. The container will click when it is closed correctly. It's important not to put the parafilm on before closing. Just use it on the outside after closing the jar. If you put parafilm on the jar before closing it, the lid won't seal properly and the formalin can leak during transport. This can cause spills, damage labels, and lead to incomplete fixation of the bone marrow core. Always close the jar tightly first, listen for the click, then wrap the parafilm around the outside to secure it. Lastly, we will go over how to package your specimens. Make sure all the slides are dry and labeled before packaging them in the slide mailer. You can use office tape to secure the slide mailer closed. Next, label each tube, container, and slide with the patient's name, date of birth, and date of collection. Once labeled, place both the clot and core jars into the small biohazard bag included in your CorePath specimen collection kit. Seal the bag and place it in its designated spot within the foam insert. Then add the slide mailers, followed by the purple top and green top tubes. After all items are secured, lift the foam insert and place it into the larger biohazard bag. Seal the bag and return it to the box. Finally, place the completed requisition form and any patient documents on top. Close the cardboard flap and add a cold pack on top to avoid direct contact with the specimens. Close the specimen collection kit. It's now ready to be placed into a clinical pack and shipped using the courier of your choice.